Hey all, and I hope that you are good. My name is Charles, and I'm here with Use and Decision. In my previous video, I talked about the student uh, who got the grades, the KCSE grades, and they are to make decisions. And I'm here to guide on the field, on the medical field, for the student who got a D, D plus, C minus, and C and above. And they want to make a decision pertaining the course they want to do, and especially in the medical field. So I'll be handling the course, the mean grade required, and the cluster subjects and their grades, and also the place that these young people can work. Start with diploma in Kenya Registered Community Health Nursing. Mean grade is always a C. Then we have the cluster subject, that is English stroked by Kiswahili. Then we have biology, we have mathematics, and chemistry stroked by physics. So if you want to pursue, that is Kenya diploma, that is diploma in Kenya Registered Community Health Nursing, you need to have a mean grade of a C. Then English or Kiswahili, you need to have a C. Then biology, you need to have a C. Mathematics and chemistry stroke physics, you need to have a C. And this course is normally licensed by, after the student does or is done with the coursework or in the classwork, they are supposed to be licensed by NCK, the Nursing Council of Kenya. And after that, they can practice the nursing in Kenya and outside Kenya, and the nursing courses normally take 3 years. In most of the places that you'll find this nursing or the nursing student, they are majorly in patient care and monitoring. We have collaborating with healthcare teams. Then they assist in medical procedures, then managing patients' records, health education. They are also somehow involved in teaching the community as well as in the institutions. They have specialized care, that is maternity and child health. Then we have emergency medical responses, and then we have occupational health assessment, corporate health services, as well as educating and training. For you to pursue to pursue diploma in Kenya Registered Community Health Nursing, I've said one, you need to have a mean grade of C. English Kiswahili, you need to have a C. Biology, you need to have a C. And then mathematics stroke chemistry stroke physics, either of those three, you need to have a C. The course that I'm going to look at is the diploma, that is diploma in clinical medicine and surgery. Once again, the mean grade is a C for clinical medicine and surgery. English or Kiswahili, you need to have a C. Biology, you need to have a C. Chemistry, you need to have a C minus and above. Mathematics, you need to have a C minus and above. Then after you're done, you must be licensed by COK, that is Clinical Officer Council of Kenya. This course takes a span of three years. The next course that I will look at is diploma in radiography. The requirement is the mean grade of a C. So for you to do diploma in radiography, you need to have gotten a C as a mean grade and above. Then English or Kiswahili, you need to have a C minus and above. Biology, you need to have a C. Chemistry or math, you need to have a C. Physics, you need to have a C and above. Again, after you're done with the 3 years, you are licensed by the Society of Radiography in Kenya. So all these courses, the nursing, the clinical medicine, and the radiography, after the 3 years, you are licensed by their boards, by the relevant boards. I've said about the nursing being licensed by the Nursing Council of Kenya, then clinical medicine being licensed by Clinical Officers Council Kenya, then the radiography being licensed by SORK, that is the Society of Radiography in Kenya. And in most cases, those people who do the radiography are the people who are in X-ray, the CT scan, the MRI, and other medical imaging technologies. They are also the one to operate and maintain imaging equipment in the hospitals, evaluate and interpret diagnostic images, participate in quality assurance, programs to enhance the quality of imaging services. So this course is one of the courses that we have very few students doing and pursuing it, but it's on a very high demand. Then the next course that I'll look at is the diploma in medical laboratory. Again, the mean grade for the diploma in medical laboratory is a C. The requirement is a C. Then we have English stroke Kiswahili C and above, mathematics stroke physics C and above, biology C, then chemistry a C. And again, after the time of the course elapse, you are supposed to be licensed by KMLTTB, which means that it is called Kenya Medical Laboratory Technician and Technology Board. So all the courses that I've tackled first, from the nursing we are licensed, and this is very important, that you are taking your child into an institution, you must inquire that that institution is licensed by the relevant boards. For the nursing, you must be licensed by Nursing Council of Kenya after the 3 years, so that you don't waste your 3 years and then get out of the market and you are not able to practice. Then for the clinical medicine and surgery, you are licensed by the COCK, that is the Clinical Officers Council of Kenya. And then for the radiography, you are licensed by the Society of Radiography in Kenya. And now for the medical lab, you are licensed by the Kenya Medical Laboratory Technician and Technology Board. So in most of the cases where you find the medical the student who pursue medical laboratory, you find them in the hospitals conducting diagnostic tests in the hospital laboratories. I'm very sure some of us have gone to hospitals and have been sent to the lab. Then you'll find them in the clinic and the health centers, where they perform diagnostic tests again for the outpatient care. Then research institutions, the KEMRI and other research institutions, then you'll find them they contribute in disease surveillance, monitoring and controlling the disease. Then again, in the blood transfusion services, you'll find them there, ensuring that there is safety and compatibility of the blood products in the blood banks. Then again, you will find them in the industries, that is the industrial and environmental laboratories, conducting the tests related to occupational health or environmental monitoring. Then you find them in diagnostic imaging centers, where they deal with collaborating with where they collaborate with healthcare professionals in diagnostic image centers. So it is so wide. I'm just covering some few that you will find them majoring in, but in all the courses, again, the nursing, the clinical medicine, the radiography and the medical laboratories, they have a wide range of specialization. So the next course that I'm going to deal with is the health record and IT. We have now, you have noticed that in the nursing and the clinical medicine and surgery, the radiography and the medical laboratory, we don't have the certificate level. But you'll find some institution who I don't think there is any institution that should be having a certificate level for the courses that I've mentioned before. That is the nursing, the clinical medicine, and the radiography, as well as the medical laboratory. They normally start from the diploma level. Then now I'm in the health record and IT. The health record IT, we have a certificate and the diploma. So for the diploma, take a span of 3 years and the mean grade is a C and above. Then we have the certificate, which again takes 2 years and the mean grade is a C minus. Health record and IT, in their major specialization, they manage electronic health records, that is EHRS, for accuracy in healthcare facilities. Then they implement and maintain health information systems for streamlined processes. Then you find them integrating technology for clinical decision support and collaborate with providers. Then you find them enforce protocols for safeguarding patients' data and ensuring privacy compliance. Then you find them to overseeing data exchange for coordinated care among healthcare entities. The health record and IT is a very wide course, and it is actually on a very high market or on a very high demand in this country, because we are currently digitizing and ongoing with digitizing our hospital processes, and they are the very key with integrating and doing all that in the hospital. We have diploma in physiotherapy. The course requirement, the mean grade is a C. Then you have English stroke Swahili, we have a C. Then biology, you have a C minus. Chemistry, you have a C minus. Mathematics, physics, and physical science, we have a C minor requirement. So a student who pursue diploma in physiotherapy, they normally conduct thorough assessment of patient physical conditions, identifying where they may have respiratory issues, and they address those issues. Develop personalized treatment plan based on the assessment. After that, they are the people to provide rehabilitation programs to improve mobility and functionality, managing the pain. Again, they are the one who develop injury prevention programs for individuals or specific population. So again, this course does not have a certificate. It normally starts from a diploma, but in case you've heard of a course that is in the physiotherapy starting from certificate, run away, because they start from the diploma level. So other courses that we have the human nutrition and dietetics, and for you to pursue a diploma in human and nutrition and dietetics, you need a C minus and above. Certificate in human nutrition and dietetics, you need to have a D and above. And again, the human nutrition, they are licensed by the KNDI. For physiotherapy, again, they are licensed. They need to have a license. Also, the health record, again, they are licensed and they are issued with license. So we have other courses that are in the medical fields that are so many. One, we have, I will not go into more of the details. We have that is the medical engineering. The requirement for medical engineering, again, the diploma is a C minus. Then perioperative theater technology, which actually is not a new course, but it's a developing new course. So the requirement for you to do a perioperative theater technology, the requirement is a C minus for the level 6, and then level 5 you have to have a D plus. When I talk about level 6, it's a CDAC course. So level 6 stands for the diploma, level 5 stands for certificate. Then we have counseling psychology. Again, the diploma, you need to have a C minus. Then a certificate, you have to have a D plus. Then you have applied biology. Then the requirement for the applied biology is a C minus. So for this video, I wanted to cover the courses that some of the students may do, to me, which seems to me marketable. Not saying that others are not marketable. So I've talked about the nursing, I've talked about the clinical medicine, I've talked about the radiography, I've talked about the medical laboratory, I've talked about the health record, I've talked about the nutrition, I have talked about the physiotherapy. All those courses, once you've done them, once you are taking your child to an institution, either private or public, ask this question: do you have the license to teach for the same? Because after you are done with your courses, you will be expected to be issued with a license that will permit you to work in any facility in Kenya and outside Kenya that deals with those issues. So if you get into a facility, or as a parent you take your child to a facility that does not have the license to teach, then it means that you're going to waste a whole 3 years for the same courses. So it is very important when you are taking your child to a facility to ensure that they have, and ask actually if they are licensed to do the same, and go to the boards and you check if they are licensed to do the same, and the information out there on public domain. So I hope that as we make decisions to whichever course that you want to join, in another video I'll do the other courses that I feel I can cover. The medical, I've started the medical courses. I will cover the electrical courses, the mechanical courses, the IT courses. So now, once you've done the course, and God be gracious enough to you to favor you, then I hope that these courses can give you a good job. So as a wind up, if you have a C, and actually not just a C, if your child or you as a person who got a C and above, you got a B minus, you got a C plus, you got whichever grade that you got from D and above, you still have a chance to pursue the education. You still have a chance to continue and to enroll yourself or your son or your daughter into a medical institution with those courses. Now, I would advocate that the courses that I've covered, I would advocate so much that we pursue those courses, and especially those courses we have the courses that people ignore, and they tend to think that they are not important, and they run and do a crowded course, and then after the 3 years you find that we are so many of us in the market. So for the medical courses, as you've seen, we have very less or very few practitioners. One, because the boards that I have mentioned, they regulate the number for each. That is, if it is the nursing, they give the specific number that should be in that class. And that's why if you go today into all facilities that are offering nursing, you find that the September intake is already booked until next year. If you go again to the clinical medicine, the courses that are offering, the institutions that are offering clinical medicine and surgery, you find that those institutions or the courses are fully booked. So the importance of the board is to regulate the modality of teaching, the grade requirement, the curriculum coverage, the place of work, the mode of teaching, and again they regulate the number in each course. So we will never have a crowded nursing course. We'll never have a crowded clinical medicine course. We'll never have a crowded radiography course. So that is one of the key things that the boards helps in, so that we don't have so many doing the same course and then they end up in the same field. Another important thing to note is that some of the boards, they regulate how many intakes should be there in a year. For example, for the nursing, there are institutions that will be permitted to have 2 intakes per year maximum. There are other institutions that will be permitted to have 1 intake per year, and there are others who will not be permitted to have any intakes based on the assessment and everything, the requirement for the nursing board. So it is important, again, as a parent, to ensure that you take your child to an institution that is licensed. I'm not marketing for any. I'm not saying this and this one is not licensed, but it is very important, once you are taking your child to an institution, you check if they are licensed to train in that course, and especially in the medical course. So thank you. I hope you've had a good time. Looking forward to have you in other succeeding videos.